Hey guys, this is Archana from Travel Sea Right, and today in another episode of the Unseen and Unsung COVID Heroes, we are talking to another COVID warrior who has been diligently and silently working to help the families of patients who are COVID patients and who have been struggling. So while people have been helping through different ways, somebody is helping in through beds, oxygen, other people are helping through foods. So, our guest today is Sneha Vachhaney. She is an engineer by qualification, a product manager by experience, and a passionate baker, or I would say somebody who made cooking her passion. But last year, when the COVID pandemic hit us, she transformed that passion into helping people. She has been helping people by providing meal, by providing ration, by volunteering with different kind of help which was required. Sneha, welcome to this episode.
Hi, Archana. Thank you for being very kind with your words. Happy to be here and talk about, these times and how each one of us can do a bit.
So, Sneha, for the people who don't know much about you, like what kind of work you have done, could you please tell us like how it started for you and what you're doing right now?
Sure. So, I think if we specifically talk about these volunteering efforts, I have been involved in some social cause in some form or the other ever since I was in school, all thanks to my dad, because he used to do a lot of social work besides his day job whenever and wherever he got an opportunity, and he made sure that he involved us. So I guess it's just, a lot about how we've grown up, and so we naturally think about others when we think of ourselves. And now that's what I'm trying to do with my child. So specifically, if we talk about the COVID initiatives, it started last year because this was something that happened all of a sudden, and none of us knew how to deal with it, whether it was the governments or the citizens or the hospitals, organizations. We were all struggling and sorry about this. We were all struggling and trying to do our best. So it was in these times that, some of the people reached out saying someone needs ration kits, or this school has run out of funds, or this orphanage has run out of funds, or there are these migrant workers going on trains and they don't have food. So we just jumped in to help wherever it was possible. And of course, there was a lockdown, so there was no help. So Mom and I used to make meals for these workers and everyone who was in need. I think that's where it all started. And then as and when there was a need in different initiatives, I tried to do my best in whatever form I could contribute, whether it was meals, funds, etc. So this year also, what is happening in Bangalore is, and I'm sure everywhere else in India, is that wherever in society some families are testing positive, some of them are asking for meal support, and that's what we've been doing, providing the same. So I was doing it in my apartment, and then I realized that, so one of my best friends tested positive, and it was a struggle to find a bed for him, and he lives 2 blocks away in the same society. That's when it hit me that, all of us need meal support or some form of support, because COVID is not just about affordability. It affects everyone the same way. And that's when I said, okay, let me just open up, my meals to the nearby areas. So I made this post on Instagram, and there were some obviously much kinder people, more thoughtful, who had already started doing this in some shape or form. And so there were a bunch of us doing this initiative across Bangalore. So the requests started pouring in. And at one point it went beyond me to just, cook meals alone. So I reached out to folks in the society, asked them, if they would be able to help. So some families signed up saying, yes, they'll be able to cook meals. And the others said that they can't make meals, but they can offer, say, monetary support to fund these meals. So then slowly it came together, and there is this this guy right outside my building who said that I would also love to support you in whatever way I can, and I have a cook and we can make meals, etc. So why don't we also help? So I think it's just a lot of people came together, and this whole thing started. Plus So that's how the providing meals initiative is going. And then I realized that this whole information was scattered everywhere. Chef Saransh Goyla had put together a list of people who were willing to provide meals. Then there was another sheet for Bangalore that was started by Shreya. There was a lot of information there. Then there were people who had reached out to me, so I had some. It was there on people's Instagram stories. So I thought, let me just do this because I have some experience in product and tech in all these years, thanks to my job that has been.
Mm-hmm.
So I just reached out to this friend of mine. We worked together very closely, and I told him that, listen, why don't we quickly make something like this and put it out there so that at least it becomes easy for people to find out where these home chefs are and reach out to them. So we put together an interface very, very quickly in, I think, less than a day.
Wow.
It's very simple. It's nothing too complicated. So we just put, I just said that none of us is doing this alone. We are all doing it collectively. So I just put this together with all the information that I had from, the various different other sources, plus what I had collected. So that interface went live. And that, I think, was super helpful to people. What that meant was my meal making capacity also went down because I was doing something else as well and connecting people and trying to see. So that interface, I think, has been very useful. People have reached out saying that, they have been able to find someone and send food to their loved ones. So that's all that is going on. And that's
basically, it's an interface which is available online. So you go there, you search for the city, you look for the chefs available, and then you can order food, right? Okay.
Yeah. So you can even you can look by specific areas. So let's say in Delhi, if you're in Delhi, you can say, I want someone who's delivering food to GK1 and order. Let's say if someone from GK1 is not available, then you can search the nearby areas also, or you can say all over Delhi who's delivering. So there are like various levels. You can start with your specific areas. Like, for example, in Bangalore right now, there are almost 120 chefs on that list, and they are delivering across, I think, 100 plus areas in Bangalore. And that does include some of the remotest areas where, usually you would.
And how are they delivering? Food. Like, what is the means like?
So it's the usual last mile delivery services, which is Dunzo, Swiggy, Teleport, whatever. I had reached out to some of them to see if, they can offer us some support in last mile deliveries, because it's a struggle both in terms of time as well as money. The deliveries cost a lot, and so we are working. Hopefully we should get some support from these companies to make this work.
What's the name of this online source where people can go and check?
But it's basically just like a one page where you select your city and then you select your area, and then you'll get a list of people and you can connect with them. So I was looking at this last night because, people were reaching out and saying how they've been using it. And I was like, okay, let me see. We are engineers. So we built this, and this friend of mine, Nitin, who I worked with, he had put some analytics in place. We never thought we'd use it, but it was there. So last night I went and I was like, okay, let me see how it's being used. And it turns out that almost, 1,000 people are coming to that interface every day. And there are people who have used it across 10 countries, if not more. And I was surprised, but then there is validation to that, because there's this girl who's been providing meals, and she had called me and she told me that, Sneha, I got a call from someone from Singapore. She wanted to send some food to her mom. And so we were trying to figure out something. So someone from Singapore, I could see that someone in Singapore has used it, and there is validation to that. I could see someone in UAE has used it. There was validation to that people were called. So it's just, I wouldn't say happy. I would say happy is the right word. I would say satisfying is the right word. That,
doing the job what it is meant to be.
Yeah, I mean, it's just my whole purpose was to simplify this and to get as many meals as possible out to people who need it. And so yeah, whatever works, I think.
So I'm reading quite a lot of negative feedback also. I've spoken to a couple of people where they have shared how some people have been really ungrateful, or have been trying to demean their efforts. Did you come across any? I'm sure major of the experiences would have been good only, where people would be thankful that at least there's somebody. But any bad experience, so you would like to share any of the two?
Yeah. So I think that's a great question. I have also been seeing these experiences that people are sharing, and like you said, that overall it's been very, very positive, and each of us are grateful, or happy that we've got this opportunity to do our bit and help. About the negative experiences, yes, there have been some where people have been sort of, so to say, ungrateful about, how people are trying to help them. So yesterday, one of the home chefs who's making food for families, she shared that how someone just canceled meals and, without any information. And then similar experiences for all of us, and she was like, I don't care if you don't want the meal, but inform me so I could give it to someone else. At the last moment, I'm sitting with 6 meals when I know that there are probably 60 people out there who need it. So these kind of things are happening with all of us. With me, there have been when I opened this up and I was getting DMs from people, there were some unwanted photos or messages that I got, and someone asked me about my menus, as to what was there in my menu, and I was like, it's a healthy vegetarian meal, and that person said, I don't want this food. And so it just makes you feel that, sorry about this.
It doesn't matter. Yeah. So,
it just, you think that, how all of us are trying to help, but there are these experiences. But I think there is just, there are days when people can't take that, because, it does affect them, because everyone has their day jobs or families or kids, and they are still trying to do the best in their capacity. But things like these, of course, they make you question that why are you doing this. But I think all of us bounce back. So one of I think the good experience, or the best thing that has happened while doing this, is I have been able to provide meals for some of the frontline workers, and that has been a very, very satisfying experience, because while like I said earlier, that COVID affects everyone equally, and so as much gratification, or as much satisfaction there is in providing every single meal, I think the satisfaction that you get by providing these meals to some of the frontline workers who really need it, that is of a very different kind, because those are the people who really need to be looked after right now. So for me, that has been one of the best things here. And I think for us, for all of us, there are these moments every day when someone comes back and says that I'm feeling better, so I won't need meal support from tomorrow. So some people have also shared this, that this is something that makes us feel very good. These are the messages we want to hear, and that people are recovering, and they won't need meal support anymore.
That's wonderful. So somebody who's got COVID, right? What kind of food should they have? Because I was talking to somebody right now, and he's probably suffering with COVID, but unfortunately he's not been able to get his tests done, because there is shortage of lab assistants. So he's not been able to eat food. They've asked the house help to not come, and he's probably not in a condition to cook. So what kind of food would you suggest for a person who is suffering from COVID?
So I am not an expert on this, but from whatever I have done since last year, or seen, I think, and even otherwise, right, if you're down with a cold and flu, you can't eat even your regular food. You can't even eat like a roti. For people who are not able to cook, or let's say if people like us who are supplying lots of meals, the one most nutritious and most easy to eat meal is your one bowl khichdi, right? Throw in your vegetables, some dal, some rice, and say some long or something. Basically, जो दादी की घर वाली खिचड़ी होती है, that and dal chawal. And down south we have rasam होती है, and rasam is good for any kind of cold, flu, anything like that. So rasam, but basically something which is very easy to digest, not oily, not spicy, not cold, something that doesn't irritate. Hydration is very important, so you should have things like coconut water. अगर आपको दही allowed है तो छाछ ले सकते हैं आप, plain मसाले वाली नहीं, because गला irritate करेगी. So you can have छाछ, or you can have some fresh juices. Vitamin C is very good, so see if you can have an orange or something if you get. North India में तो मुश्किल है शायद इस टाइम पे मिलना, but Bangalore में जैसे orange मिलती है, मौसमी मिलेगी. So those kind of healthy meals or fruits is what people should be eating.
Thanks a lot for that. Now, how can people, like normal people, the way you started, how can they become a part of this, movement where they help others? Any easy or simple way by which they can help the families who are, suffering from COVID?
Right. So that's actually, a great thing to do right now, because what happens is when it's COVID positive families, right? Their mental health is very bad. So sometimes they can't even do basic things because of both physical and mental condition, where they can't even order their groceries, right? They don't even have the energy कि एक app खोलेंगे उसमें online order कुछ करेंगे या कुछ भी करेंगे. So you can start from things which are as simple as that, which is just order supplies for them, right? Or else आप खाना बना के दे सकते हैं, आप और कुछ नहीं तो the simplest thing to do is check on them, right? And don't bombard them with messages, but check on them and just make sure everything is all right. आप उनकी medicines supply कर सकते हैं, आप उनके घर पे can make sure कि जैसे यहाँ पे I've seen some families doing it, that someone will have fresh coconut water delivered to their doorstep every day, because that's good for hydration. If you can't do any of this, you're running short of time, you can help. There are so many genuine fundraisers that are going on for vaccines, for oxygen, everything. You can just go contribute to that fundraiser. So that is another way that you can help in. So these are just little things where people need support, and this I'm telling you from first-hand experience that sometimes just someone messaging you that Sneha, I don't have I'm some vegetables for dinner, if I can just get something. So even that is super helpful. So for example, as soon as a family gets into quarantine, what they need is disposable supplies. They need water in their rooms, because someone cannot keep on interacting with them forever. So buy the water refills, buy water for them, buy disposables for them. So there is like a checklist of things that a patient needs to have, and you can prepare that home by doing that. If there are kids in a family, you can send something for kids, because they get, as resilient as they are the ones who get the most affected, because the parents are not around. So just make sure you're talking to them, sending something for the kid. There's a lot of things that you can do.
This is super useful, Sneha. I'm sure all our viewers, they would adopt many of these things that you have said. Thanks a lot. Now, you spoke about fundraisers and crowdsource funding and all that.
Right.
Have you seen any kind of scams? Because there are a lot of these tweets and messages going around that a lot of people are scamming people. Like, you want to donate money in the good faith, but there are people who are just trying to take advantage of the situation. So how can one avoid falling prey to such scamsters?
Right. So I think that's a very, very valid concern, because And it's sad also that this is happening, even though the times are like that. But forget about the fundraisers. There is this, people are doing these things even in the name of oxygen and medicines. So it was 3 days ago when I was trying to help a friend get an oxygen cylinder in Delhi, and it's been crazy there. So we had this experience where someone said that, this person is giving, but only WhatsApp. And so, we were like, okay, and there were replies, there were back and forth interactions. So you would think that this is genuine, but we made the payment, right? So the thing is, people like some people like us who would think that, okay, if 2,000 रुपए 3,000 रुपए क्या फर्क पड़ता है, दे देते हैं, एटलीस्ट किसी को ऑक्सीजन मिलेगी. So we paid, I paid, I know a few friends who paid, and at the end of the day we got nothing. And I'm sure, this is like 3 days ago, which is and then I heard that this happened to some other friend of mine the next day, not with the same person but another person. So I think more than these smaller things, there is much, probably, I don't know, I can't comment on this, but it happened to me firsthand. So I know that this is happening, where people are taking this kind of money, and at the end of the day we are not getting medicines or oxygen. So to avoid that, I think just you are going there to someone with a noble cause, so ask for, one is, if you only donate to people who you trust, or where you see that some work is happening. The second is that you can donate to these bigger organizations who are verified. And so, for example, Give India has a lot of fundraisers. I think Akshay Patra has some fundraisers. So all these organizations, and there are fundraisers on Keto. So all of these fundraisers are transparent, right? Where the you give money, it goes to a certain beneficiary. There is, even if, say, you start a fundraiser, you would be putting a beneficiary at the end of it. So and the organizations take enough pain to verify each of these things. Like, it's not that tomorrow your fundraiser can become live without anything. So you can donate to these kind of organizations which are more established, and you can trust them. And the best is that you just use those funds yourself and do something where you can help. So if you have 5,000 to donate, just call up a hospital, or if you know someone, like, you're helping staff, they also need, right? You have needs, and helpers, they are the ones who need to be looked out for. So if you don't have this surety, just help them. That's the first place to start.
Any parting thought or message you want to give our viewers?
I would just say that, do whatever it takes to help people in this situation, because the times are such that we need each other more than ever, and every little thing that you do goes a really long way. So just do whatever you can from wherever you can, and if that means reaching out to people, talking to people, sponsoring something, funding something, whatever that is, just do everything that's possible.
I would just add to that, first thing that you can do is, not be the spreader of the virus. So
exactly. I forgot to say that. Just stay at home.
Just stay at home. And if by any chance you are required to go out, then please double mask yourself. Wear 2 masks and use hand sanitizer. Take as much precautions as you can. Maintain social distancing. And if you have been a COVID survivor, then donate plasma. There are a lot of people who require it. If you have got a spare oxygen cylinder, or if you don't need it, please give it to other people. There are a lot of people who need it. And if you don't need a hospital bed, if your condition has improved, please vacate the bed, and if possible, stay at home and give it to someone who could be needing it more than you would need. So so on that note, I would like to close this episode. Thanks a lot for watching, and please be safe, take care, because when you are safe, then only you can take care of others. So your safety is most important. Take care. Thanks.
Right. Bye. Thank you. Bye.
Just a sec.